Madam President, I ask unanimous consent that the quorum call be dispensed with.
Without objection.
And I ask consent to speak as if in morning business.
Without objection.
Madam President, I think 2 weeks ago the American public understood one of the consequences of these sequestration cuts, these across-the-board mindless cuts, when they saw what was going to happen with furloughs with the air traffic controllers and the service, air traffic service in this country. Madam President, I never supported sequestration. These are mindless across-the-board cuts, and I certainly didn't want to see what happened to the FAA would have happened, and that was mindless across-the-board cuts, and we provided some flexibility to be able to avoid that circumstance. But what we need to do is replace sequestration for all agencies that are affected, because similar occurrences are happening in other agencies. The reason is that these are across-the-board mindless cuts. They are deep cuts. For the agencies that are affected, it's equivalent to about a 10% cut. This is on top of 3 years of reduced appropriations for these agencies. So it's affecting the core mission of the agency. They have no flexibility, and therefore they have to cut back on their mission. That's what happened at the FAA. And of course, we provided some flexibility so they could do some other things, but we haven't done that as far as providing relief from these across-the-board cuts in other agencies. So we're going to see many federal agencies have to fundamentally change what they do. Let me just give you a couple of examples. I was recently at the National Institutes of Health and saw firsthand the great work that they're doing. I can tell you many of the missions that they are doing are critically important to our health. I was briefed on the work they're doing for an influenza vaccine that will help us deal, not with every season having to deal with a different type of influenza and not knowing whether we get it right, but looking at one that will work for multiple years. Well, that's the type of work that's done at the National Institutes of Health. The type of work they're doing on finding the answers to cancer. I remember when I was young, if you got cancer, it was a death sentence. Now we've reduced the fatalities of cancer. The survival rates are much higher. That's the work that's done in National Institute of Health, NIH. That work is being compromised by these across-the-board cuts that affect the grants that NIH can give to the institutes around the country, including in Massachusetts and in Maryland. What's happening with Head Start? 70,000 children who could benefit from Head Start will not be able to this fall. Why? Because of these across-the-board cuts. NIH, Head Start is a program that works. We know that. The children who have participated in Head Start do much better. We have waiting lists now. Do we really want to tell 70,000 families that they're not going to be able to send their children to Head Start this fall? Senior Eating Together programs are being cut. Now, do we really want to reduce our commitment for seniors in this country so that they can get a nutritional meal? The border security protections, we're going to be debating on the floor in a short period of time how we can deal with comprehensive immigration reform. We want to do what's right, but we want to protect our borders. Do we really want to cut back on border security in this country? Food safety, the list goes on and on and on of basic missions that will be affected by these across-the-board cuts. Why? Because I heard people say, well, this isn't such a big deal. It's about 2% of the budget. The difficulty is that it applies to only a small part of the budget. That is basically our discretionary spending accounts. And these discretionary spending accounts have already gone through several years of freezes and cuts, and they have been really stretched. So the cut really is condensed into a short period of time, and there's no flexibility that is given in order to deal with it. It's going to have a negative impact on our economy. I used the example at a forum I had 2 weeks ago to a group of business leaders, and that is if you ran into trouble in your business and you knew you had to cut back, you look at your budget, you have money planned for your rent or your mortgage payment, you have some money planned for your family for the food budget, maybe you have some money put aside for a weekend vacation or trip for your family. You don't cut every category the same. You're going to save your house and make sure there's food on the table. Well, we got to do the same thing here at the federal level. We got to make the tough decisions. as to where the priorities of this country need to be. I saw the impact on our federal workforce. I'm honored to represent a large number of federal workers who are very dedicated people working to provide services to the people of this country. Well, many are going to go through what's known as furloughs. Well, furloughs is nothing more than telling you you're going to get a pay cut. Now, you've already had 3 years of a freeze. You've seen a lot of vacant positions go unfilled, so you're being asked to do more with less. And now you're being told that you're going to have to go through furloughs. That's not right, Madam President. We can do better than that. This country can do better than that. What we need to do is replace sequestration, and we need to do it now. And the Majority Leader made a unanimous consent request. I'm sorry it was not agreed to. What it said very basically is that, we can find other ways to get the budget savings, but let's not do this meat-axe across-the-board approach that compromises the missions of this country. Unfortunately, that was objected to. I've spoken on the floor before about areas that we can reduce spending. I hear my friends on the other side, I'll talk about mandatory spending. Well, I agree. We could save money in health care. The President knows the work that's being done in Massachusetts, and I can tell you the work that's being done in Maryland. We see how we can reduce hospital readmissions, how we can deal with individuals with complicated illnesses and treat their conditions in a more comprehensive way, saving on less tests that need to be done and saving on hospitalizations. We know how we can reduce hospital infection rates. There are ways that we can cut back on health care costs that will reduce Medicare and Medicaid and health care costs in this country. That's what we need to do. That will save money. Well, let's implement some of those cost savings. I'm honored to serve on the Senate Finance Committee. Our committee has jurisdiction over the tax code. We spend $1.2 trillion a year in tax expenditures. That's not touched at all by sequestration. We need to take a look at the tax code, and there are parts of the tax code that are just not efficient. Let's get rid of those provisions, and we can save money and use that to help balance the budget without these across-the-board cuts. And then we are bringing our troops home from Afghanistan. I hope we can do that at a more rapid rate for many reasons. But those savings can also be used to close the gap on the budget problems and to allow us to replace sequestration. The bottom line is what my constituents want is for Democrats and Republicans to work together and to come up with a responsible budget plan for this country. They want that for many reasons. First, that's the way business should be done. Secondly, it gives predictability. We know what the budgets are going to be. People can plan. If they know what the tax code looks like, if they know what the federal budget looks like, they can plan, and our economy will take off. Predictability is very important. Bottom line, Madam President, what I urge us all to do, let's get rid of these across-the-board cuts as soon as possible. We never should be in this position. We've seen it in a couple agencies where the public were outraged and they flooded our phones. Well, we're going to see that more and more happen because these are irrational cuts. We have a responsibility to act. The sooner we do, the better it's going to be for the American people, the better it's going to be for our economy, and it's a responsible thing for the Senate to do. With that, Madam President, I would yield the floor.